For diabetes mellitus, it is more commonly known as sweet urine, or in Mandarin we can call it 糖尿. So why is this the case? This is given, diabetes mellitus is given this common name due to the presence of glucose found in the urine. See, in diabetic patient, they are unable to control its blood glucose concentration, so it will always remain high. And for the extra blood found in for the extra glucose found in the blood, they will be transported to the kidney. Remember, in kidney there will be selective reabsorption of glucose. However, due to the large amount of glucose found in the blood, your selective reabsorption in the kidney cannot completely perform its role. That is why some of the glucose which is not reabsorbed will be excreted in the urine, and therefore for the condition of diabetes mellitus. Now for your syllabus, you got to know the two main types of diabetes mellitus, that is type 1 and type 2. But just take note, there is also a third type known as gestational diabetes. For this type of diabetes, it actually affects pregnant women. A small percentage, however. Alright? So what occurs is this: due to hormonal changes during pregnancy, your body cells may be less responsive to insulin. And this will actually cause pancreas to produce even more insulin to meet the increased demand. However, due to the target cells being less responsive to insulin, blood glucose level will remain high, and that is why for gestational diabetes. For type 1 and type 2 diabetes, here are the main differences. For type 1, alright, it usually develops early in a person's life. Whereas for type 2, alright, usually for adults, they will get this condition. They develop later in the person's life. And take note, interestingly, usually it is the overweight people that will develop this condition. Back to type 1, alright, the type of diabetes that affect young children. The main cause is this: it is an autoimmune reaction. What do we mean? Our own immune system actually attack and destroy our own beta cells found in the isolate of Langerhans. Therefore, insulin production will be affected. Our body cannot produce enough insulin. So, due to the lack of insulin, blood glucose level cannot be regulated. In type 2 diabetes, the receptor cells fail to respond to insulin. Insulin can still be produced. However, it is the target cell which fail to respond to insulin, or we can say insulin resistance has been built up in the body. For some patients, pancreas may produce insufficient insulin, right? Not enough insulin produced. And also, there can be people who produce a type of normal insulin, abnormal insulin, which does not serve its function well. That is why for type 2 diabetes, alright, it is not exactly about the lack of insulin, the absence of insulin in the blood, but it is more of having insulin resistance or not having enough insulin. You still can produce some, but not enough, and it being abnormal, the type of insulin being abnormal. So this is some diagram. As you can see here, for type 1, alright, there will be a diminished level of insulin, not enough insulin. So many of the insulin receptor will not be bind to insulin. Therefore, the transporter which is responsible for the active uptake of glucose into the body cells, alright, will not be working. On the other hand, type 2, you can see from this diagram, the number of insulin, it is still high, alright, there is still insulin in the blood. It is just that even upon the binding of insulin to the receptor, the transporter of your glucose is not functioning because it is less responsive. So this is the two main difference between type 1 and type 2 diabetes. If the question asks you to compare and contrast between the two types, definitely you have got to tell me some similarities. And here I give you the similarities. In both diabetes, there is this persistently high glucose level found in the blood. There's also the presence of glucose in urine after a meal, and usually when you suffer a wound, the healing process will be slow. Complication of disease is also the same. Alright? For people with both types of diabetes, they will have a higher risk of developing infection at the feet and the face. Disease may also affect the eyes, and blindness can be caused. For the treatment of type 1 diabetes, these patients, okay, usually small children again, they have to undergo daily insulin injection. And they got to ensure that the supply of sugary food is regulated. They cannot take too much sugary food, as their blood glucose level can be too high. Also, due to the fact that their blood glucose level can drop to very low extent, alright, they have to ensure that they have a regular intake of sweets. That is why for this patient, they have got to monitor their blood glucose level constantly, very oftenly. For type 2 diabetes, alright, usually for these patients, they can still go without insulin injections if they are just suffering from a borderline high case. Alright, so what they can do is they can watch out for their diet and to have a healthy lifestyle, maintain a healthy lifestyle. For type 2 diabetes, one of the misconceptions is that they should have low carbohydrates and a high fat diet so as to provide them with enough energy. But this is actually not so right, because the intake of fatty food can still reduce the functioning of beta cells in the pancreas. Alright, so it will do no good to their condition. A question, let's say this graph will represent the changes in the blood glucose concentration found in the blood during the 2 hours. At point X, as you can see here, what event has taken place? Alright, let's take a look at the answer. Pause the video, think about the answer. Now, alright, so let's see. At point X, blood glucose level actually increases. Which of the activity will cause the increase? Alright, answer will be very straightforward. A. After a sugary sweet meal. Alright, after digestion, the blood glucose enters the blood, therefore for the increase. Next question, alright. Let's say we are talking about a healthy person, alright. And the graph will show the concentration of glucose and insulin. Which graph will show the changes expected after a meal, alright, after a meal. Let's take a look. The legend is this. For the straight line will be glucose, dotted line insulin. Which one will be the correct relationship? Pause the video, do it now. Okay? So, which one will be the answer? Remember, the release of insulin must follow after there's a stimulus, and in this case the stimulus will be the increase in blood glucose concentration. So what it means is blood glucose concentration must always occur first before insulin secretion increases. By this, A will be the answer, because the insulin graph, alright, the straight line graph is to the left of your dotted line, alright, the dotted line representing your insulin production. So as we can see, let me just point my pointer over here. When there is an increase in blood glucose concentration, you see the increase will occur first before insulin starts to increase. Alright, so basically if the graph is found on the left, it just means that this graph, alright, whatever event that is representing will occur first, will occur before the graph to the right. Alright. Alright, the last practice question if I'm not wrong. Right? How diabetes mellitus suggests the gland that produces insulin may be considered as a homeostatic organ. So first of all, you got to identify what is the gland, alright, and what does it do to maintain homeostasis within the body. And should this fail, what is the condition, right? The clue is already here, diabetes mellitus. 3 marks. To the very last part, hormonal and nervous control.